colostomy care or changing an ostomy appliance. So this procedure is used to assess and care for the peristomal skin, and then also to collect stool for examination or assessment, and then also to minimize odors for the client's comfort and self-esteem. And then the assessment uh, is first is we need to determine the following, such as the type of the ostomy that we are be using, the type and size of the bag, the appliance, or this is the pouch or the pouch that we are using, and then also we need to review the considerations for color, size, and shape, bleeding, and bleeding tendencies of the stomach of our patient, and then next is we need to do is our planning. So in planning the materials that we needed, or we need to gather our materials, such as our clean gloves, our tissue paper or tissue or gauze pad, and then also our bedpan, our cleaning materials such as our warm cloth, our wash basin, and then our skin barrier in our pouch, our pen and scissors, and also our soap, um, and then tail closure clamp, and then our deodorant, and then our stoma measuring guide. And then next is we need now to do is our implementation. So in implementation, we need to close the room curtains or the doors to provide privacy for our client, which is our client, because this procedure is really embarrassing for some, because um, it has a very um, what do we call this? It has very unpleasant smell for others and also for the patient, and then also us to us nurses. And the next is we need to wash our hands, and then we need to don our gloves. So we need to put our gloves. And then next is we will be needing to help our patient to position our patient. So we will be positioning our patient into supine position. And then also we need to unfasten the belt of our client if there is some. And then also we need to remove the old pouch, um, and we need to wipe off the fecal residue with a damp washcloth. So this is our, so we will be using our bed pan to catch if ever there is any secretions from our pouch. So we will be removing our ostomy pouch, or our appliance pouch. So this is our stoma. This is our stoma. So be careful not to touch the stoma, because it can cause bleeding, or also it can cause the fecals or the feces to come out in our stoma, and it would be messy. So after that, we will be wiping off any fecal residues using our damp washcloth. Our damp washcloth. Just the paligid of our stomach. We shouldn't be touching the stoma side, or our stomach. And then after that is we will be putting tissue um, over the stoma, and then we need to change it as needed. So this will keep the stoma dry. And then next is um, we will now be getting our measure guide or stoma measure guide to measure our pouches barrier. And then next is so we will be tracing, or we will get the size of our stoma. For example, this is the size of our stoma, and then we will be cutting or tracing our stoma guide. Here's our stoma guide. So for example, this is the stoma, this is its size. So we will be cutting it using a scissor. This is the barrier. On its appropriate size. So in this case, there is no any measurement, so we will be using a pen or ball pen to trace the our barrier. Then after that, we will be cutting our barrier according to its size or the proper size. And then next is we will be washing our client's skin or stoma site using a washcloth and with a mild soap only. Do not use any soaps soap such as Kojic or with papaya like that. We should be using a mild soap only. For example, for like Johnson's like that, mild soap will or soaps that isn't mild can cause irritation in the stoma site. And then also after that, we also remove the all the secretions from the skin with a gauze or a tissue. So we also have here our soap. For example, our soap is in our washcloth. And then we will be using our tissue to remove all the secretions. And also to dry out the site, the stomach, the site. And then after that, we already rinsed our we already rinsed it. We need now to assure the client that if any blood was if there is any blood, small amount is normal, and then if the blood is continuously bleeding, or the stoma is continuously bleeding, we need to tell the patient that she or he needs to report it to the the healthcare provider. And the next is we need to observe the conditions of the skin, such as redness, bleeding, irritation, and then also we need to encourage the patient to make this procedure at home. So if such things happens, like like the irritation, the redness, it can be corrected. Also, we need to teach our patient how to do this procedure properly, because it can be permanent. It can be permanent, the of being using the stoma or the ostomy pouch. And then also we need to make sure that the site is dry by always, or by making sure that it's dry like that. Because if it's the site is wet, it can cause irritation to the client, because and also infection, because um it can enter the stoma site or our stoma. And then next is aray ko. We need to have our colostomy pouch. For example, aray ko, we remove already the barrier. So this is the barrier, for example. And then we need to apply the pouch onto the skin and we need to hold it for 1 to 3 minutes. Yan. So after that is we will be needing to put a hypoallergenic tape. It's a hypoallergenic tape over the face plate if needed. So using a tape may be optional, or optimal or optional. Optimal pala is optimal. Hindi ko mahalin. Where is your love? Bawal pala ko lang. Yes. Ay, ayaw maalis. And then next is we will now fold the bottom of our pouch, and then using our clamp, we will be using this to clamp this the edge of our pouch. And then after that, we will be disposing our old appliance or our pouch into the nearest dispose or trash bin. So after putting our old pouch, we will now remove our gloves, and also we will perform aftercare of materials. Aftercare of our materials. Then we will be removing our gloves, and then we will perform hand washing, and then after that is our evaluation. So we need to note appearance of our stoma, if it appeared if there is any redness or itching, or redness, like that, something like redness, irritation, ayun, redness and irritation. And then also if the skin or the excision is yeah, if we need to note the stoma, if there is an incision while the pouch is in place or is removed and skin is cleansed. And then also we need to report any deviations to the healthcare provider. And then also documentation is we need to document or chart the type of the ostomy pouch and the skin barrier, the size that we measured a while ago. And then also we need to record the amount of the appearance, and the affluent in the pouch, the size of the stoma, and the color of the stoma, and then also the texture, and then the condition of the peristomal skin and sutures. Thank you.